think of plastic surgery, do you often think of the Gabor sisters? Well, think again. The new face of plastic surgery, more likely than ever to be, is male. I'm joined by a plastic surgeon and one of his patients to talk about men who elect to go under the knife and just why. Dr. Darrick Antell is a plastic surgeon at Beth Israel Medical Center, and Lee Rudnick is his patient. Good afternoon.
Good afternoon.
Interesting, doctor, that things seems to have changed over the last few years. The numbers are almost staggering. Why do you think that is?
Well, Felicia, I think there are a number of reasons why that's happened. I think that part of it is improved techniques and availability. I think part of it is that the aging baby boomers want to maintain those tight-fit bodies that they work so hard to achieve. And
Why, thank you.
but I also think people are working longer. You know, they're talking about raising the retirement age to 67, and Medicare wouldn't kick in until then, so people need to stay in the workforce longer.
Is this our answer to aging gracefully? I mean, is this sort of our youth serum? Since we don't have a youth fountain, is this really the answer?
Well, I think that aging gracefully is wonderful, and I have some great jeans that I love to wear that are nicely worn, but I think what we're really talking about is looking your best and looking the way that you feel on the inside. And sometimes people are a little bit haggard looking and they don't really measure up to the way they feel on the inside, and that's a more legitimate reason for having surgery.
Lee, I'm going to turn to you. What made you finally decide to do it? What was worth it?
Well, I was 50, which of course was a big shock, you know, being the baby boomers. And I just felt, I don't know, I just felt I was ready. In the business world today, you know, there's a lot of people in their 50s and they're competing with people in their 30s. And I think that was part of it too. And I just said, I just want to do it. I feel comfortable doing it. And I just decided to, somebody, you know, through recommendation, recommended Dr. Antell. And I went in there and I was pretty comfortable. They have a good staff in the office. It sort of makes you feel, you know, not so nervous. And I got settled down. I said, well, let's do it.
Was it really more business concerns? I mean, in the sense that you were competing with people much younger than yourself, or was it also partly social?
No, I think it was social. I'd go to the gym and see all these people, and I was trying to, you know, there's certain things you can do with exercise, but there's a point where you can only do so much, and I would be doing this and the treadmill, all that stuff, and I said, you know, it's time, and I felt comfortable, and it used to be a very female thing, but then I knew of other men who had started to have it done, and I said, well, why not? It was my birthday present to myself. Was that or
nice
a Porsche?
Right. Well, so the Porsche might be coming, right?
Right.
Dr. Antell,
Yes.
how many, or what percentage would you say of your patients are now men?
I would say that traditionally it's been around 12 to 15%, and in my practice it is increasing. We are definitely seeing an increase in it. And Felicia, I'm not sure if they mentioned, but I've had surgery as well. I had my eyelids
I was going to
done.
ask you if you had had surgery.
Yes, and in my particular case, I had some fat scraped out from the lower eyelids, and I just got very sick of people telling me I looked tired all the time when I wasn't.
What do most men elect to have done? What kind of surgery is done?
The most popular operation is to have nasal surgery. That's number one. Number two.
I've thought about it. I really have. Absolutely.
Number two is eyelid surgery, and number three is liposuction. Those are the top three.
And Lee, what did you have done?
Well, let's see, in a non-technical sense, the first time my nose, which I did have a breathing problem, I had it sort of tightened under here, and I had some liposuction done. Because with all this exercise, there's still those sort of love handles, I guess you call, and you really can't get rid of them. So I decided to, I got down as thin a weight as I could, and then I went to the surgery. That was the first time.
You were brave enough to bring in some before and after pictures, and I think we're going to take a look now so that the doctor can describe exactly what he did. Let's take a look at the before pictures, if we can bring those up. There we go. Doctor, tell us what you did.
Well, what Mr. Rudnick had done was he had a little bit of fat vacuumed out from underneath his neck. He also had his chin moved forward to make it a little bit stronger, and he had his nose sanded down on the top. Now, the final thing was to take a little fat out of his cheek, right in the central portion of his cheek. Now, Felicia, these procedures were not all done at one time. There were two separate operations, and I think that he was just so happy after the first operation that he came back, and about a year later we did some additional surgery for him. So to review it was sanding down the top of the nose, we made his chin stronger, fat out of the cheeks and under the neck.
Were you satisfied?
Oh, very. I was, it was interesting because the psychological part was something I hadn't even thought about. The fact that, I mean, I always had a good social life, but all of a sudden, you know, people would become more aggressive. I'd feel more comfortable.
What do you mean people would become more aggressive?
Well, people would come up to you and say, I'm having a party, I'd like you to come. You really
people
look
meaning
nice.
women?
Yeah, women, yes. That's what I was trying to be. Yes, women. And it was kind of, I went to his office and I said, what's going on? You know, it's like, again, I had a life before, I was married before, divorced, have a child, but it was just something different. And as much as we like to say our society is also based on people being good people and everything else, it is a visually oriented society to begin with. And men that are in their 50s certainly are either been through their second childhood or have those feelings, and, you know, all of a sudden it was, well, do I marry somebody who's 30 and have another child, or my own age, or whatever? But the point is, those options that I didn't feel were open were then open.
Hindsight, would you have done this earlier?
Yeah, when I was about 16, I think.
I don't think you needed it when you were 16.
The nose part. I think the other stuff, maybe, but I just don't think I had the, I just don't think I was there to, you know, probably yes, though. I'd say maybe 5 years sooner.
Dr. Antell, why
Yes.
do you think men are becoming a little bit more attuned to this? And I mean, absolutely procedures have improved, but do you think that overall today's society is becoming more vain?
Well, I think that vanity has negative connotations. I think that what it really is they're a little bit more concerned about looking good, and they know that it's available. It's just like having a nice clean shirt on, or you have a nice blouse on. You want to look the best that you possibly can, both for your work and for social reasons.
Lee, the most common procedure amongst men is liposuction. Is
Right.
that something that you're familiar or comfortable talking about?
Sure.
Or would you do it, or had you done it?
Yeah, as a matter of fact, I didn't do 100%. There's, I guess you do different sections, and I seriously would consider now going back and doing the little portion that I didn't do, because as much as I've dieted and everything else and gotten pretty down to where I want to be, it's just not going to go away. So I would say that. And the other thing that was surprising was this, whatever the technical term is, the little fat things, which, again, just never disappear. I mean, I see people in the gym, and I see them before and after, and they've done good strides, but there's certain things that are never going to change.
Is this an answer to weight loss, though? I mean, certain body makeups naturally aren't going to be perfect. None of us is perfect, really, no matter what you do.
Right.
But liposuction isn't an answer that people should think of as a way to change in terms of dieting.
You're absolutely correct, but I do think that there are always diet-resistant areas. When I went to the Olympics last summer, there were some athletes who had a little extra on their hips, mostly women. And there are some people, no matter how much they try to diet or watch their cholesterol, they're still going to have a little extra in one area or another. And those are the ideal candidates, and we can help them.
I think we have some examples that we can bring up now, if we'd like, to show the differences in certain candidates. There you go. Doctor, will you show us a little bit, or explain to us what took place?
Yes.
Clearly, there's a dramatic difference.
This particular patient was primarily concerned with what are called the love handle areas. This male patient
Aren't we all?
This male patient had a suction-assisted lipectomy, as we call it. That's the technical term, which is removal of fatty tissue in that area. This is an outpatient procedure. It's done under local anesthesia with a little sedation, so they're comfortable, and they can go home afterwards. Most people return to work in about 3 days.
In just 3 days?
Uh-huh.
That's remarkable. I mean, clearly that has changed over the decades, or however long this procedure has been available to people, that you don't need that much time to recover?
Well, the recovery is not complete. You can return to work in 3 days. You're still going to be a little bit stiff. You're still wearing an elastic garment. It takes about 2 weeks before I have people resume strenuous exercise, but they can return to normal activity certainly within 3 days.
Are some candidates better than others?
Yes, you have to really judge the elasticity of the skin. Some people have very loose skin, and if you take the fat out, they might then have some additional loose skin, so you might want to consider taking skin out as well. But people that have good elasticity, and that includes a large group of people, are very good candidates for liposuction, assuming they're otherwise in good health.
How long did it take before you were completely recovered and ready to go back out into the public's eye?
Well, actually, interesting enough, the first time with my nose, I guess because I lived in Midtown Manhattan, I remember walking to Bloomingdale's and I still had like a bandage just on. People were like, you know, okay.
Nobody seemed to care. It's New York City.
Yeah,
though.
right. It's New York, but you know, we're in another town. It might be a little bit different. So I felt, you know, much faster than I thought, and I started to get around, and you know, it was a very short amount of time, much more short than I thought it would be.
You hinted that you would think about, you know, procedures in the future. Are you thinking about anything in the years to come?
Yeah, I would think, well, two things. I think, you know, maybe the additional liposuction, and then there's always the facelift or neck lift or whatever you call it, which, you know, I'm 52 now, maybe 8 years down the road or 6 years down the road, depending on, I certainly would do that. And again, part of it is the business world, too, because of the fact of what we're involved in today. It is a different world.
All right, gentlemen, thank you for joining us this afternoon.
Thank you, Felicia.
Dr. Antell and Lee Rudnick talking to us a little bit about male plastic surgery.